feel like you're getting that support from the UK government?
I think the 2018 delegations with Prime Minister Theresa May was a wonderful example of how governments, UK government, could support businesses, because it enabled us to enter into a market that, as you know, is still one of the most important markets, both for pharmaceutical companies like AstraZeneca, but also for some of the healthcare companies in the world, and accelerated our inroad into that country. And recently, past few years, we have seen a lot less of those. And I think it's such a lost opportunity for UK and UK innovations to be great everywhere.
You've spoken about how the depth of liquidity that you can find in the US is basically uncomparable to anywhere else. I mean, where do you think the UK is lacking there?
I think liquidity is one part, but also the mindset of investors around companies that they provide basically cash positive and then they get dividend is a very different to the mindset of companies that they can list in the US and NASDAQ. For example, probably if Amazon would have listed in London, they would have had lots of struggles for the first 20 years that they didn't make profit, right? And there is a little bit of education and shift, but also funds that they know and understand technology and what it takes to build a global business that is changing an industry rather than improving something slightly. And I think one of the good things that they can do, UK governments, like starting a very big sovereign fund, investing in these companies in the UK, supporting the London Stock Exchange and initiatives like that in the UK.
What else would you like to see from the UK?
If I look at our journey of Huma, where we started and the struggles we had in the beginning, I think without tax incentives like SCIS and EIS, would have been probably extremely hard or borderline impossible to get to where we are. So doubling down on those kind of initiatives, I think, is one thing. And then coming up with ideas that how can we look after entrepreneurs, but most importantly, people.
You've spoken about how your business was launched in the UK from your time at university at Oxford. Do you feel a loyalty to the UK? Would you like to remain in the UK?
UK for me is a very special place because this is where I started. And it's not that I get parallel lives to live in different countries and see now what would the situation been if I would have started, let's say, in the US or elsewhere. And I have what I have, and we have achieved what we have achieved because we started here. The collaborations with London NHS teaching hospitals has been quite an important partnership with hospitals, doctors, and consultants that they really care for the patients in ways that I haven't seen in many countries. Has been very important for us to get to this place. So I totally feel loyal about what's happening and our commitments to the UK. But at the same time, it's really important to make sure that government supports and give air coverage to innovation. Last week, I think the report of came out of James Ashanahi report about clinical trial. We are behind. We are falling behind, right? Since 2018, it has dropped by 50-60% the number of clinical trials we are doing in the UK. We can change that. They named us as one of the most important innovations for clinical trial as well as care in that report. And we want to partner and make UK the greatest place for the citizens of the country to get the best care, because NHS has so many good things about it,